Evening and welcome everyone to today's session. International Forum for Promoting Homeopathy is conducting this session daily without any break for last 897 days. So today is our 898th day, and I'm grateful to the person, those who are working behind this team. Many lovers and doctors are working behind this. Thank you everyone for the participation, and let's start our meeting with a silent prayer. Good evening once again, and welcome all the participants for our Zoom session. Today's our guest is Dr. Nandakumar, well-experienced person. He has a lot of experience and exposure. He traveled all around the world, and actually, for introducing himself, we need a 1 hour session because we have to introduce. Can you hear me? Yes, right. Okay. For introducing himself, it's a huge process because we have to say more about him, even though everyone of you know him very well, even though I'm just running through running to introduce him, Dr. Nandakumar. And he's running a clinic in Amrita Homeopathic Medical Center, Palakkad, and he is the faculty of 30 international conferences, 50 international homeopathy conferences in Colombo, and Dubai International Conference in London, and homeopathy conference in Bangkok. Faculty to train government homeopathic medical officers in the Department of Homeopathy, Kerala, and international teaching faculty of IHK, and he is a guide and visiting faculty of postgraduate schools at Hanuman's Homeopathic Medical College, London. And he is the winner of, he got many awards. He is the winner of N.K. Jairam Award 2019 and the best doctor, that is for the best doctor award, and Vaidyasri Puraskaram in 2019, and Rotary Excellency Award in 19, and Prem Nasir Karma Tejas Award in 2022. He has been invited for 3 prestigious events in the year of 23 in Toronto Homeopathy Conference and World Cancer Conference in London in 23, and European Conference in London. And so I already said to you while talking about all his conference and all, we need a separate session. So I'm just said few words about him, and we are so grateful to you, sir, for your presence in our forum. Thank you so much, and you can talk now. Thank you. Nice. Sir, please welcome. You can start talking. And all of you know about our physical meeting on 19th of February. I'm so thankful to all the people that they have contributed to for conducting our physical meeting. Thank you so much for your support. And those who want to contribute, again, you can, you have the chance. 2-3 days are remaining. I think those who are the international participants, if they want to send the money, means we will give you the different account number. We will provide you. Please contact with someone in our.
Can you hear me now?
Yes, sir. Yes.
Okay, fine.
Okay.
So can everybody can hear me, right?
Yes, sir. Yes.
Okay, thank you very much.
You already missed 10
minutes. Yeah, but I don't know why. I was the first person to join. Maybe I was the 5th person to join.
I know.
We lost some time.
So I was thinking you are.
So just I will share the screen later, but before that, very good evening to everybody here for taking the great. I'm really privileged because many seniors are there. My teacher is there, Bhadra Madam. So it's a great privilege for me today, especially because of the presence of great people like her, and to all the well-wishers of homeopathy, and also all the members of the IFPH, because this is an organization which have been always in the forefront to fight for the prestige of the great system and up to uplift the privilege and the pride of our system during the difficult times, even during the COVID times. So I'm honored, and I take it as a privilege today to be here. And I thank all the people of the organizers for inviting me for this for the speech today. I don't want to waste the time. I will directly go into the session. This here, as the time is so much abbreviated and we have only a very small space of time left, it's only 40 minutes, I think. So I would like to give emphasis to different cases that all are pathologically advanced cases, how we manage the pathologically advanced cases with homeopathy. I would like to give emphasis to the word management, because in homeopathy, whenever you attend speeches or classes, I think many often we hear the word cure. Cure. I cured that, I cured this. The cure happens in chronic diseases or pathologically advanced diseases only after only in a very well managed disease. But first, initially, it is your responsibility to manage the disease, because the patient will have complex symptoms. So now we will proceed to those cases, and it will be like I'll be showing you. First, I'll be showing you in every case. I'll be showing you few cured cases first, and the protocol. Here in my clinical practice, after 30 years of experience, I follow a protocol system, because of course, the individualistic, holistic, everything is there, but I am here to share my experience with you. So now, if every case is different, then my experience has no value. So I am here to share my experience with you. So the protocol, what I usually apply in such cases, and that will be shared with you today. So I'm going to share the screen. Can everybody see the screen?
Yes, sir. Yes.
Okay. So this is the management of pathologically advanced diseases. So first, we will go into a case of brain tumors. So among in my clinical practice, I feel that the most successful tumors or cancers which we can manage are the brain tumors. Not all brain tumors. If I go into the depth of brain tumors, there are so many varieties of brain tumors. So, but not all. But there are some varieties of brain tumors which we can manage very successfully. And first, we will go into those cured cases, and you can see the experience of my patients.
Sir, actually,
Yes.
can't hear. They are telling we can't hear their voice.
I don't know why, but I think
It's okay, sir.
I have presented this in different international seminars. There's the English translation is stripping down.
Okay, sir. It's okay.
Okay. And this is the first MRI report. You can see that multiple ring enhancing lesions as described suggestive metastasis of the brain. In MRI and ring enhancing lesions, it's the phrase which is usually used to specify brain malignancies. So in this report, you can see that there are multiple ring enhancing lesions as described. His name is Shamsuddin. Now, after the treatment, in between, the patient had a mild stroke. That's why the initial some MCA infarct in the left parietal lobe, etc., are seen. But you can see one thing: no ring enhancing lesions detected. So the tumor has completely resolved. No ring enhancing lesions detected. Again, you can see the result of the MRI, no ring enhancing lesions detected. Other findings are is old age, cerebral and cerebellar atrophy and all these things, but the tumor has disappeared. So we all know that the great work of Dr. Banerjee Saab, his work in US, he has done a great research in US regarding the brain tumors and the action of Ruta-6 and Calcareous. Of course, those two medicines are one of my favorites in treating any form of brain tumors. So I also give Ruta-6 and Calcareous 3x and both BD. That is the first protocol which I follow in each and every brain tumors. Plus, many a times or more often, we get some peculiar characteristic symptoms. So that is also given along with that. But this remedy, both are given continuously throughout. And after 3 months, we take one more scan to confirm that the size of the tumor has reduced. So this is one case. Now, another one is pituitary macroadenoma. You can see his experience. I don't know whether you can, his voice is audible, I think. You just read, because for presenting this in international seminar, I have given, yeah.
It's okay, no problem. We can read.
Now you can see. Can you see that?
Yes.
Okay, just it is blocking my view. You can see it's pituitary macroadenoma of Mr. Abdul Haq. In the first scan, it is dated 31/1/2011, and I will go fast because we don't have much of a time. This is the second one taken after 2 years. You can see the last line, most essentially a normal study. In view of the resolution of the cellular supercell lesion in the previous MRI study, most likely to be a neurosarcoid resolved. So there is no tumor in this MRI. It has totally resolved. Again, it's Ruta-6 and Calcareous 3x. But in this case, I still remember I had a he had a very peculiar symptom. In few cases, I have given this medicine with this peculiar symptom. This person always had a salty taste in the mouth. I'd like to tell some uncommon peculiar symptoms also of some drugs. So whatever he drinks, whatever he tastes, it tastes salty. So there are few drugs, cyclamin is there, Maxol is there. But I used to give Maxol 1 mg monthly, 1 dose to this patient, and intercurrent prescription was tuberculin. So in brain tumors, apart from this is what Banerjee sir usually gives. But in my experience, I give tuberculin 10 mg monthly, 1 dose for first 3 months, and check after that whether there is the tumor is resolving or not. Then this is a very interesting case. A child, a couple, after 8 years of marriage, the lady became pregnant, and when the maternal scan was done, the child presented bilateral choroid plexus cyst. Usually when it happens, when the child is born, the child will be mentally retarded or will have some physical or mental abnormalities. That's a normal finding. So usually always the gynec always insists for a maternal termination of the pregnancy. But since she got pregnant after 8 years of wedlock, she didn't want to do the abortion. And the patient came to me, she's in Mangalore. And I gave medicines to the mother. So Lucy Salvador, choroid plexus cyst. You can see that the child. It is it's a maternal scan. It's a bilateral choroid plexus cyst is seen, and antenatal sonography. You can see the bilateral choroid plexus cyst is seen, and again, obstetric ultrasound. No evidence of any obvious intracranial cyst detected. So this is one of the most interesting case, if you ask me, because here treating the child by giving the medicine to the mother, and the cyst totally disappeared. Again, Ruta 6 calcareous tuberculum was my choice of drugs. Intercurrently, I gave syphilinum 1 dose to this patient because by birth, because of this, it's a maternal problem, but the child is having a problem by birth. So syphilinum 1 dose was given in between. And I would like to share one thing. In many of these tumors, whether it is liver, whether it is brain, one drug, one medicine, which I always choose to give continuously is on Hydrastis 3x. I give Hydrastis 3x 10 drops twice for almost all patients, except the fact that in some cases I have my own specific mother changes or dilutions 3x, which I give. But in other ways, I have found myself a very effective medicine to reduce the size of the tumors, Hydrastis 3x. And I think our late great Patel sir also was using that in large in many of the tumors. Now I will go to another screen sharing. Now another one, it's vitiligo. It's a very common thing nowadays. I don't know what, because of some, maybe because of our changed dietary habits, the environment, our stress, all put together, the number of cases of vitiligo has increased in large. I've been practicing for the past 30 years, and now I find many number of vitiligo cases. But my dear friends, we have a large scope in this field of this disease, where the modern medicine has nothing much to offer. We have much to offer. So I humbly request you to just concentrate. See, in homeopathy, you can succeed if you can specialize in few diseases. No need to 1 or 2 or 3 diseases. People will just flow from all over the world to you, to your clinic for the cure. Only thing is that it should be result oriented. So I will show you a few cases of vitiligo, and I will share my experience and my protocol in treating vitiligo. This is before and after treatment. Other photographs you can see. This boy is from Nagaland. He came all the way from Nagaland, and you can see the change. It took me 4 years for this result, for this total cure. So my choice. Pardon? Anybody? Did anybody ask any question?
There is only showing the psoriasis slide, not the picture of.
You are not getting the slide photos, no?
No. I can see the photos in the side, in the bar, not in the main session. We can see this psoriasis written. Again, you stop sharing. Yeah? No, sir. Now it's completely stopped.
Now,
yeah. Now only see your face. Not the computer. I mean, I think you have stopped the sharing. Once again, you share the screen, then
I will share. Now can you? No?
No. I think once again you have to start. It's already stopped.
I think I have to sign in again.
No, I that will take more time. Once again, you share the screen. From the beginning, you have to. I think so. Any
But I can't. 1 second.
someone from the technical field, please help.
Now is it okay?
Yeah.
Vitiligo?
Started. Yeah, Vitiligo.
Okay. Fine. Oh, okay. Now you can see. Can you see?
Yes.
Okay. This is the before and after. Again.
Yes.
I told you about this boy, I think, from Nagaland who came all the way. Now, my favorite, I will start that medication by giving 1 dose of Cifilinum CM. Usually, everybody says Cifilinum 10M, but I have found myself Cifilinum CM is much more faster than Cifilinum 10M. So, no medicines for 2 weeks. After that, you have to give Mica 30 weekly 1 dose. That you have to continue. Mica 30 and arsenic sulflavum 4x BD. Just continue this with Ammi visnaga mother tincture external. Ammi visnaga mother tincture it's an exceptionally good drug. It has so many other properties. I will tell you in the next slide. But for vitiligo, Ammi visnaga is almost as specific as an external. And intercurrently, you have to give once in 2 months or 3 months 1 dose of tuberculinum 10M. All this, nothing more, nothing less. I think just continue this. You will see the wonderful results. I have produced the results in more than 90. Whatever protocol I am saying is what I am presenting here. All these are taken from cured cases, so more than 100 cases. Common drugs. Of course, the uncommon, peculiar or prescriptions are there. You also have to take the case, and if you find any specific drug for the patient, you can give it. But when you come to the protocol, these are the medicines which have been very commonly used. That's what I would like to share. The other one you can do by yourself. So this is about Ammi visnaga. You can see the Ammi visnaga is it's like a carrot. When I went to Egypt in 4 or 5 years back, I saw the plant. It's like a carrot. In Egypt, in Sahara Desert, it's seen growing in Sahara Desert. And there the people use it for making tea. And they use it for gallstones and kidney stones. So it contains 2 principles, schelin and visnagin. It's also a natural vasodilator. Not only a vasodilator, it dilates all the tubes. So it can be given in 2 conditions as an emergency. Like if suppose in kidney stone, if the stone is stuck somewhere inside somewhere in between the ureter, and you want to dilate the ureter because the ureter is 6 mm. The dilating capacity is 6 mm. So if the stone is 5 mm, it will be stuck inside the ureter. So if you want to dilate the ureter so that the stone can just fall off into the bladder and can escape through the urine, you can give Ammi visnaga even as a painkiller. So that will push the stone downwards and it will fall into the urinary bladder. Again, in acute asthma, you can give Ammi visnaga because, as I said, it's a vasodilator as well as it's a bronchodilator also. So mix a few 30-40 drops in half or 3/4 glass of water and ask the patient to take very frequently, 2 to 3 spoons. Definitely it will give an instant relief to the patient. So it can be used, as I said earlier, in vitiligo, it is used as an external. And also for psoriasis, it's used, but I have not used much in psoriasis. But many of my colleagues in abroad, they have said that they got good results. And also for menstrual cramps, that is dysmenorrhea. And of course, definitely in kidney stones and gallstones. So next is alopecia areata, another place where homeopathy can do wonders. The modern cosmetic industry is looting many patients with alopecia areata with all the technologies and the so-called drugs, but nothing works. So here we have some golden drugs for completely curing alopecia areata. I will show you a few cases of alopecia. Can you see the
Yes,
photograph?
yes.
Okay, okay. This is before. You can see the improvement. Totally cured. I have more than 50 photographs with me different. So many cases I have cured, and I can bravely take any number of cases because this protocol works miracle. It's acid flow 10 one dose, is monthly one dose, and Vitiligo 30 BD, and Amloki external, but you can give it internal also. Amloki mother tincture, you can give internal also. And earlier I used to use Amloki tincture as external, but nowadays I am using Ammi visnaga as external, which I found more effective than Amloki. So you can give Amloki mother tincture 15 drops twice or 20 drops twice, and Vitiligo 30 BD, plus you give acid flow 10 m every month one dose, and you can intercurrently give sulfur 10 m one dose in between after 1 or 2 months. You can see the miraculous change. And don't stop Vitiligo. Let it go on until you see that the hair follicles are stimulated and there are small hair is just growing from the follicles. You can just stop all the medicines and just apply the external. Ammi visnaga is better than Amloki. Cholelithiasis, a very difficult case, but I should say that I get 60 to 70% success. My success rate is 60 to 70% in cholelithiasis. I cannot cure all cases, but when you see from the modern medicine point of view, there is no cure with medicines. There's only one treatment, that is removal of the gallbladder, cholecystectomy. Even the stones cannot be removed alone, so the gallbladder has to be removed as a whole. So in young ages, when patient comes, they are a bit worried about that, and so we get a lot of chances to treat cholelithiasis, and we can see here few cases. You can see Mr. Dilip, he has multiple small calculi, thick sludge studded in the lumen. And Mr. Dilip, the gallbladder is normal distension caliber outline, no echogenic focus in the body. No stones. Again, Mr. Ashraf, you can see gallbladder contracted, shows hyperic focus 10 into 9 mm. Yes, Ashraf, gallbladder, no echogenic focus. Again, so Johnny has multiple calculus, 3 to 5 mm in sizes. Johnny doesn't have any calculus after a few months of medication. Again, Mr. Nimita has 2 to 3 calculus, 3 to 4 mm, and here Nimita has no calculus. Again, Sakir has few intraluminal calculus. Sakir has no calculus. So many cases. And when it comes to liver, let me tell you one thing. My favorite is magnesium uriaticum. Maybe those who have gone through the Sense of Materia Medica by the George Vidolkas, and you have read magnesium uriaticum, he has said that it's a specific for liver disease, and he has explained so many stories there regarding liver cancer, liver cirrhosis, chronic liver diseases, and all other liver ailments. And many times he has mentioned magnesium uriaticum to be a specific for liver disease, though he has explained the mental side of the magnesium uriaticum, where so much sufferings, mental tensions, and all these things. Maybe that's a part of how you should write a book, but you should read in between lines when you prescribe a medicine, and when you read also from our great authors. Cardus mother tincture, you have to give BD, and cholestyrinum 3x TDS. nowadays I am giving chelidonium 0/3 also, alternate days 1 dose, which is found to be very effective, and it's more faster. The treatment, the dissolving the stones becomes a little more faster when you give chelidonium 0/3. That's chelidonium 6x is also very good, and that can be given along with that. And if you find the patient to be lipo or phos or sulfur, sulfur is another drug which is very good for cholelithiasis. Why? Because the intrahepatic biliary radicular circulation, when there is a biliary stagnation, that's why many a times the cholelithiasis happens. So when you read sulfur in detail, you know that the sulfur is a drug which promotes the intrahepatic biliary radicular circulations. So sulfur also can be given as an intercurrent remedy, not only in this, in chronic liver disease also. So just go to the literature of sulfur and you will know the role of role of sulfur in liver diseases. Another case of CA prostate, this is multiple metastasis. It's not a cure, but you can see from the PET scans taken at different times that usually with such a widespread metastasis, it is very difficult to bring back the patient or even give a slight relief to the patient. But in these two PETs, we can see that the METs has also reduced in numbers. The number of lymph nodes has reduced. There was skeletal metastasis. You can see that in astomedicity, that gallium PSC, the prostate malignancy, so many, multiple pelvic lymph nodes. It's underlined yellow. You can read that. And sacrum, ischium, acetabulum, all affected with METs, secondary METs. So in the second one, after our medication, you can see, and that those hospitals, they just wrote off the patient. Nothing can be done much. Patient was suffering with great pain. So there is a sclerotic lesion in the right ischium. See, it is not a malignant one. Again, you can see that the bilateral inguinal nodes are PSMA non-abate. And here, my prescription is carcinosin 30 alternate days for 2 weeks, but I just continue that. One of my favorite drugs in treating prostatic cancer is Crotalus horridus. Not only in such cases, if you get a case of benign hypertrophy of the prostate and you find the prostate specific antigen on the higher side, you try Crotalus horridus 6 BD or even TDS 3 times. You can see the PSA dropping. Nowadays, the patients are well aware about the investigations and what the significance of the investigation, significance of the findings. So when a patient knows what is PSA and he wants to bring down the PSA, so it's our responsibility to bring down the PSA. Then Solidago 0/1 in water dose. That's you can add 5 grains in 1 ounce of water and shake it well, dissolve it well. Ask the patient to take 20 drops twice continuously. And for skeletal metastasis, my specific is aurum iodum 30 daily 1 dose. Aurum iodum. And for pains, symphytum 3x. Sometimes I give 10 drops every 2 hourly to get to give relief to the pain. And after that, it is continued 3 times or twice. Now there is another disease. Left, right, center, you can treat PCOS because 6 out of 10 young girls has PCOS. Now I'll be going to Canada for 2 seminars in April. I'll be leaving on 20th for attending the Canadian Homeopathic School Conference on 23rd. And then other one is WHC, World Women's Conference. It's a huge event for 3 days, and I'll be presenting ovarian tumors there in both the seminars. So in that, PCOS is one of the main. I have submitted the paper in for that because there is a lot of formalities for that. It's not a homeopathic seminar, WHC. So we have to submit our paper earlier. So they have to go through that and they have to approve. So I have we have to be very scientific in explaining how your medicine acts. So here I'll be giving you a slight explanation a brief explanation about how our medicine acts in PCOS, especially in one drug called cinnamon. You can see Mrs. Suma has polycystic ovaries. Here again, she has polycystic ovaries, and now we'll go to the next last, the normal study. So all the other pathologies, polyp and ovarian, everything has disappeared. Okay, I will go to the previous slide. Now you see, she has fundal intramural fibroid is there, endometrium is thickened, and bilateral polycystic ovary. After the second slide shows bilateral polycystic ovaries, the intramural fibroid has disappeared, and the third one all has disappeared. Now it's pulsatilla 6. We have some studies have been done with pulsatilla 6 in polycystic PCOS, polycystic ovarian syndrome, and found to be very effective. Other one is cinnamonium mother tincture, which has to be given 10 drops BD continuously, and calcarea floor. Other drugs, as you can read, Bovista, calcarea carb, calibrum, tuja, palladium. If it's on the right side alone, very rarely you get PCOS, unilateral PCOS. PCOS are usually bilateral, but sometimes you get unilateral. But in that case, if it is right-sided, you can, palladium is my specific with lycopodium, and left it is tuja and lacacis. And when you go into the depth of the PCOS and its pathology and causes, many times the modern medicine claims that it's because of the insulin resistance, but it's not always true, because when you look into the constitution of the patient with PCOS, you can see two types of patients. One is lean patient with PCOS and obese patient with PCOS. The obese patients might be having a insulin resistance, but not in lean patients. So there you have to differentiate the constitution. Maybe you can give calcarea carb and phosphorus, whatever the constitution demands. According to research carried out by Alan V. Schmeckler, 36 women suffering from, this is what I told, the research with pulsatilla 6C. So 30 of the 36 women had complete disappearance of symptom of PCOS. Unfortunately, we don't come across such findings, even though we do a lot of research outside with our drugs, but we don't come across all these things. It's a very unfortunate thing. But remember, we have already done a research with pulsatilla 6C in PCOS. And how does cinnamon act? The cinnamon contains polyphenolic compound called polycyanidins. And how does it act? They mimic the effect that insulin has in the body, and inhibit certain enzymes in the intestinal tract and convert carbohydrates into glucose, reducing the glucose load from whatever you are eating. The chemical compound in cinnamon, which is responsible for its insulin-like activity, is a water-soluble substance called methyl hydroxyl chalcone polymer. So this will inhibit the sugar supply to the tumors, so that it cannot grow, and gradually it will shrink. So this is the pathology what is happening. So I have made a detailed study about this, and which I'll be presenting in Toronto on 23rd of April and on 16th of May. And this is about the obesity. We don't have much of a time. I'm just let me sweat through my slides, because few interesting cases are there. This is a case of pulmonary artery embolism. You see, it's a deadly case with pulmonary hypertension. The patient can die at any time. I'll show you his testimony. Before that, this is the report. Earlier, you can see that the RVSP is 98 millimeter of mercury. This is the first one, 3590. Not much of a time was taken for this. And after 4 months, see, it is only 40 millimeter of mercury. Now he will say his experience. Now, arnica 3C BD, hemamelis 200 weekly 1 dose, Glyceraceae glabra is my favorite in any embolism, or if I want to dissolve any blood clots anywhere in the body, even if it is in the coronary artery. Of course, we prescribe platelets, but my choice is Glyceraceae glabra. Why? I will tell you in the next slide. And constitutionally, I give antium ars vernam because the patient told that he cannot even climb 1 or 2 steps. When he came to my clinic, he was not able to come and sit next to me from the chair which is put on opposite. That's the usually the patient sit. And for examination, when I asked the patient to come and sit next to me, then he was gasping. So anti-March was given with all the anxieties regarding the operation and his future. And the doctor actually explained to him the critical situation, the critical condition, what he is going through. So that can happen at any point of time with such a block in the pulmonary artery. This is the Glyceraceae glabra. You can see. Many a times Glyceraceae glabra we use for cough, but it's a wonderful drug to dissolve blood clots in our body. It contains an active drug, glycyrrhizin, which is considered to be a powerful anticoagulant and usually in sore throat, chronic bronchitis. Of course, you can use it for cough. It's a wonderful drug for cough. But with this medicine, you give in, I have made miraculous results even in stroke, in cerebrovascular accident, as well as in cerebral embolisms and in even in accidents, road traffic accidents, where there's a blood clot, and if you want to dissolve it, we have read about arnica. We all know about arnica and the power of arnica to dissolve. But give Glyceraceae, and even in portal vein thrombosis, it has created wonderful results. So whenever you want to dissolve a blood clot anywhere in the body, whether it's in the coronary artery or the common cerebral artery or right RCA, LCA, give Glyceraceae glabra as a background remedy, because it's very scientifically, I can explain to you how it acts. It's an anti-inflammatory properties, and see the PAF, platelet activating factor, substance found in the blood which cause the blood to become thicker and to produce blood clots, resulting partial paralysis and loss of memory. It has been used in high blood pressure and atherosclerosis. Adine illandakkuna, that dissolves the blood clot through this process. This is the process how it, and this is the pathology. This is the reverse pathology. What happens when you give this mother tincture to these patients? Another case is a CA liver. Anjani, its time is over.
Only 5 minutes. We have few questions in our chat box.
Okay, they are just a cancer case. I just want to know, you can give many people know, but regarding when you treat the cancer liver, one drug I want to explain. These are 2 cases. We can see the known case of small cell carcinoma, SOL liver, and now you can see after that features of chronic liver disease, no discrete focal lesions on ultrasound, it is said. Solanum nigrum. I just want to explain to you about the Solanum nigrum and its role in treating liver cancer. Colostrinum 3F we all use for chronic liver disease. Lycopodium 30, as I said earlier, sulfur 0-1 is also one of my favorite in treating anything regarding liver, whether it is chronic liver disease or liver cancer. And see, this is a article which was published in Hindu. We have been using it for so many years, but we never knew. And they did the research in with Solanum nigrum and found that it is one of the most specific. That's Maratangali. In Kerala, we say it as Maratangali, and it is taken from Maratangali. And the allopers, they use the sorafenib. Now it is supposed to be the most latest chemotherapy drug, sorafenib. For all liver cancers, they use sorafenib. And if it is more effective than sorafenib, that is the finding which they got after doing the research with the leaves of Solanum nigrum. And we have this miraculous drug with us in our shelf. So this was done in National Chemical Laboratory, Pune, and also found in Government Medical College, Trivandrum, and all there. These are the places where the researches have been done. And so many other studies regarding that. And a small video of my Amrita Homeo Medical Center, a small video. Just want to let you know how we function. Okay, it's written 25 years, something made 5 years back. Now it's the 30th year. We are celebrating our 30th year in 2023. So thank you very much for all for listening, for patient listening, and you can ask some questions if you want.
Now we have only 2 minutes for the questions, but I think we have some questions already in the chat box, and everyone wishes to hear from you. I think there is no one more session. We want many sessions from you. Everyone is requesting for that. And what is your protocol for retinal bleeding, diabetic polyneuropathy? Actually, we don't have much time. Only 1 minute.
The retinopathy, Crotalus horridus 6, Lacus is 200 weekly 1 dose, Crotalus horridus 6 TDS, and Arnica 3C BD. That is my choice.
And Dr. Hubert, Dr. Hariharan, all raising hands. And
yes, Dr. Hubert.
But I think there is no time for for their question. I'm so sorry, doctors.
And other one, what is that? Apart from one more for polyneuropathy. So diabetic neuropathy. See, in all neuropathies.
Diabetic polyneuropathy.
Yes. I take it as numbness because the patient always presents with the symptom is numbness, either numbness of the hands or numbness of the foot. So if it is, it can be either polyneuropathy, diabetic neuropathy, or it can be even carpal tunnel syndrome. If it is carpal tunnel syndrome, it's a common thing where there is only numbness of both the hands. There, my specific is calcareca tenem, which I give 4 doses or 3 doses today night, tomorrow morning, and tomorrow at bedtime. And aconitum is my specific for numbness of the hands, arms.
Thank you so much, sir. Now it is our time for moving to Malayalam session. And actually, everyone was eager to hear from you, and they want to ask questions to you. So we are expecting more sessions from you. Thank you, sir. Thank you so much.
Let me come back from Canada, then we will have one more session.
Okay, no problem. Thank you so much, and it was a wonderful session, and it gives us more confidence. Thank you so much, and I am inviting Dr. Ashok Kumar for moderating our Malayalam session. Thank you, sir. Thank you.
Thank you.
And you please go through the chat box, and if you can, please give a reply. Thank you.
Yeah, I was.
Dr. Ashok Kumar, please. And those who have feedback or if you want to ask something, you can text in the chat box. Dr. Ashok Kumar, Dr. Danesh. Dr. Ashok Kumar joined. So